So a common question people want to know is how age affects fertility. In terms of women, age does have a big impact on fertility. And so we know that as we get older, the number of eggs decrease and the quality, meaning how good is the egg, that decreases as well. In terms of what age does it actually decrease? Really the thought is that after 35, we definitely know that the number and quality is going down. After 37, the thought is that is going down a little bit quicker. And then definitely after 40, we do know that the quality is really on the lower side. That being said, in terms of treatments, using your own eggs, definitely we always want to do an evaluation first because different women have different genetics and different potential of what we call ovarian reserves. And so after testing, we'd be able to tell you a little bit better, personalized to you and your body, what we think your chances would be. In terms of any types of cutoffs, we don't have any definitive cutoffs, but definitely over 42, it is going to be much harder to get pregnant with your own eggs. Definitely over 45, the chances are going to be on the very low side. But that being said, after your testing, your physician would be able to give you a more personalized statistic and ability for you to potentially use your own eggs. In terms of carrying a pregnancy, the good news is that that does decrease in terms of chances, but if you're using a normal chromosome embryo, which is what we are trying to seek by doing IVF, the chance of getting pregnant with that embryo really doesn't change based on age. The complications that could arise in pregnancy, though, those do increase. So definitely in terms of someone who's younger versus older, in terms of the actual pregnancy itself, in terms of complications like preeclampsia, which is a blood pressure issue, or diabetes, preterm labor, needing a C-section, all of those risks do increase with increasing age. So definitely if someone is over 45, we would absolutely want to do further testing and have you see a maternal fetal medicine doctor just to make sure that your body is able to handle the extra stress that comes from a pregnancy. Definitely at 55, we would say that at that point, that's kind of a soft cutoff depending on your health. In terms of men, we do know that age affects sperm as well. Men get a little bit more time than women, definitely over 40. We're starting to see impact on sperm, definitely over 45. So for that, testing is also important. And then in terms of how does that affect getting pregnant, definitely in terms of doing something like in vitro fertilization, we're going to pick the best, fastest moving sperm. But in terms of getting normal embryos or the quality of the embryos, that's where we see that can go down as a man gets older. So in terms of your age, like we said, really, we just really advocate to get testing so that your physician can give you a more personalized answer directly for you. And if there's any questions, definitely someone should always at least come for a fertility consult. And from that, we can answer them for you.